right, good evening, everyone. Thank you. I'd like to call the meeting to order. Board of Health, Town of Fairfield, November 8th at 7:31 p.m. Thank you for everyone making the trek down here. We certainly appreciate the effort. Hopefully everyone had a chance to take a look at the meeting minutes from our October meeting. Does anyone have any comments, questions, edits? If not, if I can get a motion to accept the minutes as written. Can I get a second, please? Second, thank you. All those in favor?
Aye.
Any opposed? Wonderful, motion passes. Why don't we move on to the Director of Health report? Sam?
Sure, I'll give a quick COVID update. Generally things are going well. Our numbers are relatively level. Last 2 weeks before that, they were level at around 40 some odd cases, and then we came down to 24 cases. This week we're at 15 cases so far, but we have a couple days to still cases still be recorded. Generally everything is looking good at a national perspective. State and county hospitalizations are somewhat level. I mean, the last week or so they saw a slight uptick, but in general it's been relatively level. Fairfield Public Schools, currently has 10 students and 4 staff. They've had 96 cases so far this year. Currently have 59 quarantines with 59 student quarantines, 2 staff, and they're up to 333 total quarantines for the school year. Not all of those are, of course, related to in schools, and a lot of them are community-based transmission quarantines as well. Vaccination rates, the town isn't necessarily moving that quickly. We've been for about 5 weeks at a 67%. We're kind of 67.1 and 67.3 and 67.5. So we're moving upward, but we're still at 67%, 67.75% fully vaccinated. That's the total population. For the eligible population, we're at 80.23. We're seeing some good numbers. The 12 to 17s are 77%. The 18 to 24s is still 54%. Again, that's low. We're talking way about how we can really figure out what's the most accurate number for that, because that really is underreported. So we're going to talk to the state, I think, about how can we get a true estimate for that age range, because we don't think it's accurate based upon the college population. As I said before. So just real quickly, 25 to 44 is 78%, 45 to 64 is up to 88%. These are fully vaccinated, and 65 and older is up to 94%. So we spent quite a bit of time in the past 3 weeks since we last met working on our annual report, submitting that to DPH. So that is finalized and into DPH. That takes us a couple weeks. It's 100 plus different questions and things we have to submit. We did have on the 29th our third large flu clinic down at the Senior Center. We did this, as with the other ones, co-located with Griffin, doing COVID vaccinations while we were doing flu vaccinations. On the following day, on the 30th, the Saturday, we did our first large booster clinic. We did 711 booster shots. We had capacity there. We didn't fill up with all the appointments that we had, and we also had Griffin there handling anything else but Moderna boosters. They did everything else, and they did about a little under 150 people, 148 people there. So we have this week coming up, we have our pediatric clinic. We have about 460 appointments. People coming. We filled up quick. Yeah, we're all a little nervous about the kids' clinic. We've changed our clinic design so as to have vaccination stations in different rooms, so that you don't
freak each other out, right?
Chain reaction going. And so we'll try. I think we're going to utilize the entirety of the senior center from one end to the other. So we'll give that a try, and that'll determine, we're basically seeing actually a lot of cancellations. We had a little glitch with VAMS. We still haven't, they don't figure out why, but we set up our clinic for 462 appointment slots, and it filled up. We posted it at 12:01 midnight, and by the time myself or one of my staff who was watching it woke up in the morning around 6:30, it was full, and by the time she went to bed at like a little after midnight, there's 50 people already had signed up right at midnight. So people were watching.
But we don't know where they're from.
No.
Town-wise.
No, I mean, we can look in on the back end, but, we haven't assessed that and we don't restrict it.
I'm just curious.
So that was good, but, so we filled up right away, and so we were, just let the clinic sit there in VAMS, and then we noticed the number starting to go up and up and up, and we got up to 510 appointments, and then finally we had to actually pull it from being visible in VAMS, but since we pulled it in being visible in VAMS, 60 people have canceled. So that's saying that there's, a lot of people are finding it elsewhere or somewhere earlier than that. So, which is a good sign that there's availability out there.
Can people go in now with the 60 cancellations?
We haven't opened it back up yet, because we don't want to, it's so close to it, we don't want to shoot way over again.
Right.
Amy did said we could schedule, in our office, if there's one or two people that need to schedule, if they call in. But don't make it a hotline.
Call you in?
They can call me.
So that, that's the big event this week. We're working on that, of just getting ready for that. That's just going to take a lot of staff time. We've got a bunch of volunteers coming, and that's really the focus. We're doing it on Veterans Day when everybody's off. Our offices are actually closed that day, and so we're all coming in to do it on that day. And then we'll have the follow-up clinic on December 4th for that Saturday. So that's what's going on COVID-wise. I guess I'll say the last thing COVID-wise is the state, as you probably heard, announced last week the Screen and Stay program for the schools, which will, essentially those who are unvaccinated or partially vaccinated will, in some scenarios, will not have to quarantine, but instead they can opt into the Screen and Stay program where they would sign an affidavit that they're going to abide by the rules of it, and then they have to daily monitor themselves for symptoms and, essentially not attend school if they have any of the selected symptoms. And so, we think it won't eliminate quarantine because there's certain criteria in there. For example, if you were still within 6 feet with your mask off while at the cafeteria, you're still eligible for quarantine, or those people that are close to a case would still be eligible for quarantine. But it eliminated buses altogether, so that's a great thing that we don't have to worry about contact tracing on the buses anymore. In class types of things, as long as the kids are wearing their masks, they don't have to quarantine now, which is great.
Did that already take effect?
No. We're kind of piloting it at one of the schools for a select group.
So but the plan is to roll it out as soon as possible, and once just have to have the systems in place of where does the form go and who's collecting what and who's going to be reviewing it, and so once those things are in place, that program will roll out, and that'll come from the superintendent in terms of the details of that. We worked on we had commented on a document that's planning to go out for that, and had a meeting with the leadership today. So that's the big change in COVID. The governor indicated, and the state DPH staff have been saying things like, once vaccination rolls out, that's going to be a game changer. The governor was directly asked about, are you going to wait until February 14th to lift the mask mandate when it expires? And he said, essentially, we're going to do it when it's the right time. I'm not holding out till that date. I'll, when if conditions continue to improve, we'll consider it. And so, which is some indication that, the numbers are going in the right direction, that, he may do something before that, possibly, we continue to do work on the fill use issues. So we've been working on, and you can see we've got a lot of different sites. These are all the different sites that we're working on with the fill use issues. I can pass this around, but basically and this is on our website here, and we're working through, and basically we've got these number of sites, depending on how you break it down, it's some 44 different sites or locations. Some sites have multiple locations on one site, if you will. So we're working through that, and basically we've the LEP, the Licensed Environmental Professional, that the town of Tyre has done a lot of additional sampling. And so right now, the town had entered into this consent order with the EEP, and so we're working through that with an attorney and with the LEP to kind of one site at a time get them and get all the documentation that is required. So they, if it was remediated, then we submit a remediation report on them. If it was investigated and remediation wasn't needed, we submit an investigation report. And so we're going through the process of that. And then we have to, essentially some of these sites, consult with the EP and say, are you okay, given these findings, if we do this strategy, and wait for them to reply, and then we'll do what they recommend. And so we're going through those sites. We've got a number of them where we've submitted the final documentation to them, and are just waiting to see if they have any comments on them. And essentially they'll, if they do, they'll comment on it and suggest some edits or something like that, or some additional work potentially. But we've done everything that, we believe, the consent order asked of us, and then we wait to hear from them. So we'll continue to work on that. Next month, we will have a couple of different things on our agenda. We'll be setting the calendar for the meetings for the year, and we'll also have our elections for officers, for chair, vice chair, and secretary. So if you're interested in that, to consider that, and we'll take nominations at the next meeting. And then I just wanted to just take a moment to thank Dr. Henry Ewan for his service for the last 8 years on the board, and serving many of those as chair, and just providing wise counsel to the health department and to myself in particular. I appreciate that, and it's always been nice to have you available when when things happen. He's been alongside me for a number of different large scale concerns.
Fiascos.
So, it's been greatly appreciated by me and the department as well. So, thank you for your service.
Thank you. I wish I could say that it flew by, but it's been the experience for those of you who, I know Sans, I've been sort of hanging around the Board of Health for a number of years beforehand, just my interest. I think I'm probably one of the only few actual public that used to sit in one of those chairs and come to the meeting. So, having said that, I'm not gone completely.
You're going to go back to those chairs?
I go back to the chair and give the board a hard time. What are you guys thinking? What are you So,
and of course, you are welcome in the December meeting. It allows for a carryover. If you wish to come and run the meeting until the new chairperson is appointed, you are more than welcome to come. If not, the vice chair will handle the duties for that meeting, but I understand if you want out.
No, I plan to be around, so thank you. So having said that, I think everyone should be aware that if any of you have, or know of anyone who has interest on a board position, please let Sans know, or I know there's something on the website as far as...
Yeah, essentially we do it right at the meeting. typically, I mean, we can do it anyway, but we just typically take nominations of people who are interested in running for that. But yeah, I mean, it would be helpful if we have multiple candidates for a position, you know, to be able to prepare a slate. So.
No, I'm sorry, I mean, for the seat, right? Because the seat has to be filled.
The open,
Or
the
appointed,
vacancy
yeah.
on the board, will be handled by the first selectwoman's office.
Okay.
Yeah, they do the appointing for the board of selectmen.
Fantastic, all right. Well, great, thank you. Any questions for Sands? No? All right, fantastic. Jill? Please.
Thank you, Henry. I mean, I will miss your guidance as our board chair. I really will. And I really appreciated all your help over the past few years.
And vice versa. You know, it's funny, Jill makes it sound like I'm doing her a big favor, but it just means that I call more frequently, going, what are you guys doing over there? And how can we bring that back to Stanford?
So as Sam said, we had the screen to stay protocol that was introduced over the weekend and will hopefully be operationalized by Wednesday. We're going to be attending the DPH SDE call tomorrow, and I have my laundry list of questions for clarification, and then I'll be meeting with the staff, you know, elementary, middle, high school, private nurses, and just reviewing the protocols for it. It certainly will be awkward. But you know, everyth's awkward at first, so I'm sure it'll work out. I'm so behind it. I'm really supportive of it. I think it's a wonderful opportunity for kids to be in school more. Mm-hmm. What did we figure out, Sans? It would probably be about 30%.
Well, since they changed the nuance of the bus, I think it's somewhere between 35 and 50% reduction in quarantine.
In the number of quarantines.
Yeah.
And I have to tell you, with vaccinations happening, you know, that will even be less.
Yes, as soon as that happens.
So I'm looking forward to it.
Reduce.
As far as my department is concerned, we had our professional development day on election day, and we had all sorts of speakers come in. It was the first time we've been together, you know, clearly in 2 years. We had a lawyer from, is it Shipman and Goodwin, or Goodwin and Shipman? Shipman and Goodwin. And he is the lawyer, the attorney that FPS uses. So we just had him review some issues, particular to school nurses, legal issues. We had someone from our local EMT service come in and review tourniquet use and stop the bleed procedures. One of our nurses, who actually was trained as a diabetes educator. Yeah, she presented two presentations, one for the newer nurses who may not be that familiar with, you know, the various pumps and monitors and Omnipods, and then a more advanced class for the nurses who are definitely more familiar with it. We had a couple of webinars that we were able to tune into on communicating effectively in difficult situations, which many of us have been involved in this past year. We also had a webinar from Children's CT on the mental health epidemic among adolescents and children. And that's what do they call it? Legacied, or it's available. I mean, if anybody wants to get it, you can access it. It was really quite good. Finally, in the afternoon, we had a speaker. It was a live speaker, but it was Zoom on transgender issues in the schools, and that was really well received, really opened our eyes to a lot of issues that the kids are going through, and you know, how we can approach them with not only unbiased, but a more accepting, more approving attitude as we treat them in the nurse's office. So that was it. That was enough.
A lot of hot topics.
It was hot topics, yeah. And then what we're also doing, we've signed up we've made an agreement with Sacred Heart University. We're going to be doing 12 student nurses for the spring semester. 6 for one 6-week chunk, and then, you know, the second half of the semester, another 6. So everybody's looking forward to that. The school nurses love it. Get the opportunity to mentor someone that we don't often have, just to get a little help. And the school nurses, it's going to be an eye-opener, I think, particularly this year with COVID and what have you. So I appreciate Board of Ed for, Bank allowing us to get those visitors into the schools. And that's about it.
Great, thank you. Anyone have any questions for the
Where
chair?
is that archived mental health thing available?
At Children's Connecticut, they do a webinar every Friday morning
Oh, okay.
for about an hour. So just tap in, just Google Children's Connecticut and unbelievable resources, I think.
There is one other mental health thing that's going on this Thursday. I'll send a link to everyone with all the local elected people with like Tony.
Oh, that's right, yeah. Tony Wong is
Tony
going to be
Wong
there.
and all the state reps.
What time is that, Andrea?
At 7 p.m. It's a Zoom meeting. But I'll send a link to everyone tomorrow.
Yeah, thank you.
We're still alive.
I know, at the end, that's true. No, I was just going to comment on the student nurses. That's great. I supervised SHU grad student clinicians for speech for a number of years, and I know it's been such a challenge to
get
find
them in,
placements. Obviously the last couple years locally, so that's great that you're doing it.
Yeah,
Because they need it,
pretty
and it's
successful.
such a great learning experience, right, when you have to analyze everything you do and why you do it, and the rapport and everything in real time, so.
In March of 2020, I teach at Sacred Heart as well in the public health courses, and they absolutely lost all of their clinical public health rotations for that spring, and we were just scrambling, trying to figure out something relevant for them to do. So I'm
people had
really
called
happy
me begging, and I'm like, I'm in home, you can't do it with home health care, you can't, I came at the nursing home, it was fine. But even nursing homes weren't taking, because it was extra PPE, there was just so much, it was like.
Yeah,
so
some are
much.
sticking to still the 18, some are letting us go in with other students. Like I had the girl that sat here this summer that was under 18, and it just depends on the facility and how they read what the governor is suggesting.
Fantastic, well, thank you. Sans, any communications?
I have none.
Any old business?
We have none on the agenda.
All right, any new business? I'm really trying to stretch this out to at least a half hour. I don't want you guys to feel like,
Yeah, I drove down from Shelton.
I know, right? Any new business, okay. If no one has anything else, can I just get a motion to adjourn?
Wow. Motion to adjourn.
All right. Fantastic, thank you, everyone.